Good afternoon, everyone. This is Dr. Hart, and I have for you some more test questions. These are fundamental test questions, NCLEX style. These are urinary elimination. And this is a chart that I got from the NCSBN published public website. There's the source at the bottom. This is the RN NCLEX test plan. Okay. Then these are the percentages of each of these. The category or section that I'm going to cover part of is the basic care and comfort, which covers a total of 6 to 12% of your NCLEX. Can have questions on basic care and comfort. Basic care and comfort, the definition is providing comfort and assistance in the performance of activities of daily living. And part of the content underneath that is to assess and manage client with an alteration in bowel and bladder elimination. So I thought I would cover those two things, and this would give you an idea of where this content comes from. This is directly from the NCLEX test plan, and it's a certain percentage that I showed you of that of your NCLEX. Those are the percentages of questions that you may get on these categories. All right, so let's start with the first one. All right, so these are on bladder elimination. A woman is reporting bladder urgency. It is most important to assess A, exercise, B, weight, C, caffeine intake, or D, vitamin supplements. And I'll give you a minute to think about what you think the answer might be. And I'll take a minute now to encourage you to share, like, and subscribe to my YouTube channel, Nursing with Hart, PhD. My TikTok is Susan Hart 63 or SusanQ. So take a look out for that too. I'm also sharing these test questions on that platform as well, YouTube and TikTok. I'm going to be sharing very soon also on Instagram. All right, so let's go back to this test question. Woman is reporting bladder urgency. It's most important to assess, okay? Assessment is the first step of the nursing process. So assessment is going to be a big part of your NCLEX exam and a big part of your fundamentals exams. Okay, and the correct answer on this one is letter C, caffeine intake. Okay, and the reason for that is that fluids or food that have alcohol or caffeine, such as coffee, tea, cola, or chocolate, these all will irritate the bladder, and they have a diuretic that will increase your patient's urine output when they are ingested in large amounts. So you want to assess your patient's caffeine intake when they are reporting bladder urgency. All right, let's look at the next one. The nurse should instruct the female client who has experienced 2 urinary tract infections within the past year to do what? A, void following sexual intercourse. B, use shower gels and bubble bath. C, avoid drinking cranberry juice. Or D, apply powder to the perineum. All right, I'll give you a minute to think about this one. Okay, and the answer on this one is letter A, void following sexual intercourse. So there are factors that increase the risk of urinary tract infections. and they are, excuse me, the incorrect wiping of the anal area after bowel movements. So you should teach your female patients they need to wipe from front to back. Okay, the female anatomy has a short distance between the vaginal area and the anal area. So if they think about it, if they wipe from back to front, that can introduce feces into the vaginal area, which will may cause the E. coli from the fecal matter to be introduced into the vaginal area. Okay, so teach your female patients wipe front to back. In any procedure that places an object in the urethral or bladder for diagnostic procedures or therapeutic reasons. Okay, so introducing any, so after sexual intercourse, the female client should void to get rid of any bacteria that may be introduced into the vaginal area. Okay. The nurse is caring for an older adult client suspected of having urinary tract infection. The nurse should assess for what findings specifically associated with the development of this condition in the older adult. Letter A, high fever. B, dysuria. C, acute confusion. Or D, nausea. Okay, we'll give you a minute to think about this one and then we'll come back. All right, we're back, and so we're looking for the nurse who is caring for an older adult. The nurse is suspecting that the older adult has a UTI or urinary tract infection, and the nurse would assess for what finding is usually associated with the development of this condition in the older adult. In other words, what assessment finding would be typical? What other assessment finding might be typical for a UTI in the older adult? All right, and the correct answer for this one is C, acute confusion. So symptoms of UTI are different in the older adult, especially if they have a depressed immune system. Rather than experiencing painful urination and high fever, the older adult may become acutely confused. Okay, so the acute confusion may be an indicator of a UTI. All right, let's look at, and that is the last one. So I'm going to come back in a few minutes with another one on bowel elimination. So that's it for now. Enjoy the rest of your day. We'll see you in a little bit.